Good afternoon, everyone. Welcome to the Lunch and Learn session for the month of April. Today, I'm really happy and excited to share that we are collaborating with International Community Health Services. We have Kailyn, Elliot, who is an infection prevention and control administrator, and we also have Theo from Kailyn's team, who was doing a lot of back and forth communication with me until we came to this stage. So thank you so much to both of you for being available and doing this talk with us. This session is part of the COVID-19 engagement outreach project that Eastside Baby Corner is doing with Seattle King County Public Health. So this month we are trying to target on specific topics or information related to changing mandates and where we are going with the pandemic, because we are still not done with it, because here and there we hear about new variants coming up, but we also see that the life is getting back to normal with some fear in mind. So I'm going to request Kailyn to get started without taking much of your time and just give us all the information. And once again, thank you to both of you, Kailyn and Theo, and to the participants, because without whom this is not possible. So I hand it off to you, Kailyn. Take it forward.
Thank you for having me and us. My name is Kailyn Elliot. I'm a registered nurse. I am the infection preventionist for ICHS. For those who don't know, ICHS stands for International Community Health Services, and we provide community health care to all types of individuals. It started predominantly with Asian American populations who were drastically underserved and who continue to be underserved, and so therefore we still exist and we are expanding. And our goal is to serve as many people as possible who need it. Thanks for having me. I actually prefer back and forth with conversations, so I prefer questions if you like. I have a few topics as well we can go over. Does anyone have any burning questions that they want to ask? I know there was one earlier from Snow, something about home health.
Yes, would you like me to repeat my question?
Yes, please.
Yes, so the question was, how do we mitigate the risk of transmitting COVID during home health visits to unvaccinated infants?
Yeah, great question. So the answer is the same for all unvaccinated individuals, and the best place to start was out with a good plan. So whomever is going in, make sure that everything is that you need to do. You have all the equipment that you need, so you don't have to do any back and forth. You have a general idea of what a timeline is. You're dealing with children, infants. Of course, they like to mess with your timeline. And that's okay, but it's always good to start off with a really good plan. Part of that plan would be asking anyone else in the household that can put on a mask to wear a mask while you're there, and then to just minimize the amount of time spent directly with those who are unvaccinated. Any other follow-up with that?
That's great, thank you.
Yeah, perfect. Anyone else? Okay, so I'll just start talking a little bit, kind of going through just some big picture ideas that I know are weighing on people's minds, whether or not they want to ask a question. And one of the biggest one is, what is the current state of the pandemic, right? Like, where are we? When's it going to be over? And that's a really interesting question because it comes down to a couple different items. One is how we're defining a pandemic. For example, the World Health Organization and the CDC have similar definitions, but they're not exact. So for WHO, their definition of a pandemic is one that affects countries worldwide, so all the way around, versus the CDC, which their definition is when an epidemic spreads to other countries, several countries or continents. It doesn't necessarily have to be all the way around the world. And then also it comes down to what we're willing to put up with. And for example, there's still influenza every year, and technically it becomes a pandemic. But most people don't really think of influenza as a pandemic because we have, as a society, decided that this is an acceptable amount of individuals who get sick, even though it definitely qualifies as a pandemic seasonally. And so the current status of the pandemic is really dependent upon the filter and the lens with which you're looking through. And it's not going to be an easy question because the next question is usually going to be, when does it become endemic, right? And going from a pandemic to endemic depends on, in general, when the widely circulating disease is more or less constant levels, constant seasonality, something we can predict, and it doesn't fluctuate too much. And it also depends on the number of people vaccinated. And it also depends on, again, people's attitudes toward the disease, people's attitude with what they're willing to put up with again, but also with how people define their community. So I gave the example of influenza. Another good example is cholera. Cholera is endemic and technically qualifies for the CDC's definition of pandemic because it does stretch multiple countries. And so it really just depends on the lens that you're looking through. And I think that it's less helpful for folks to define and give rigid boundaries and put items in a box than it is to ask questions, keep asking questions, and to do what you can do to protect yourself, your loved ones, and those that you are working with and that you're trying to provide either care for in some sort of way. I'll pause there for a second to see if anyone has any questions with that. Okay. Some of the other questions that I'll get is herd immunity is another one. And what level do we need to reach to make that herd immunity? And the answer is we don't know. And it changes from disease to disease. So for example, measles, which most people know about, and fortunately a good majority of folks are vaccinated for, requires a 95% vaccination rate to achieve that herd immunity versus, say, polio. Anyone here known anybody that's ever had polio? Very, very, very few people probably have personal interactions with those who have actually survived polio. Well, you only need about an 80% vaccination rate in the area to achieve that herd immunity. So there's no magic line or magic number drawn in the sand that says, okay, we've reached this number, now we're protected. The answer comes down to as many as possible vaccinated. Those who can get the vaccination, I highly recommend that they do. And if you have questions or a little reluctant to get the vaccine, my response is to just keep asking questions. Not that you have to be convinced otherwise, but just so that everyone is on the same page and that you as in the general you, afforded the opportunity to ask those questions and afforded the opportunity to make a really sound and informed decision, is what I'll say about that. And then the next question I'll get is about variants usually, and what does that look like, and what about the immunizations and how do those interact? Well, again, to achieve that herd immunity, we have to have a large number of individuals typically that are vaccinated. Now, what happens when you have a population that is vaccinated, and let's say 90% are vaccinated, but there's a small community adjacent or within travel distance, and now that we're all internationally connected fairly easily, that small population that isn't vaccinated or has a very low vaccination rate gets the virus, and the virus can then mutate and then cause what we know are variants. And then that variant gets reintroduced to the population that had immunity through immunizations previously, and then they now are sick. And they're confused, like, what happened? I have my vaccine. I have both vaccines. I have my booster. I got my second booster. What's going on? And the answer is that the virus has been able to mutate, and it's got to a point that it's changed enough that the immunity you have doesn't recognize it. And that's how, vaccines work, right? It's able to recognize the virus. And people say, well, what's the point of getting the vaccine if I going to get sick? Well, the answer is the goal for your immunity is to, if you think of it as a library, and each book in that library is a vaccine. If you got the polio vaccine, the hope is that you never have to deal with the polio virus. But if you do, that book can be checked out, and it can, help provide immunity for that person. And like I always like to say, you can never have too many books in the library. So if you have an immunization that you actually never end up using, that's fantastic, but it's there if you need it. Any questions about that? Or what questions do you have about that?
Hi, Kailyn. I have a question. My name is Isabel.
Hi, Isabel.
Hi. How do we talk to parents? So right now that we're going from pandemic to endemic, so they hear that in the news and they haven't been vaccinated, they have babies, and they still ask questions. They actually ask like, okay, so now that the cases are going down, then I don't need to get vaccinated. My child is still gonna get protected to the rest of the people. So I feel like it's a little bit of fear of getting the vaccine and mostly the side effects. But I'm finding it challenging trying to explain to them the reason why they could still get vaccinated and protect the child.
Yeah, that's a great question, Isabel. Thank you. So first, sometimes it's hard being in healthcare not to want to be like, no, this is what you need to do and this is why. It's not helpful, unfortunately. What I like to ask people is, first off, what do you know about the vaccine? What do you know about vaccines in general? So you can really assess their health literacy rate. So, you could be talking to someone, and I've made this mistake before of overly explaining things to folks who were immunologists, to folks who have less education, who don't know anything about the immune system other than that it's there. And so for folks who say, well, if everyone else is getting it, why do I? I would give examples. Folks who don't have a firm academic understanding of these things, I find respond really well to stories. And so a good story is measles. We have a vaccine, a very effective vaccine against measles. However, we still get measles outbreaks, and the measles are deadly, right? Kiddos can still die from it. And those who end up dying from it either are too young to get the vaccine, or they didn't receive the vaccine in general. And if they would have received the vaccine, they most likely would have been protected against it. And so for those who are hesitant to get the COVID-19 immunization, explain to them that yes, the immunization works and a lot of folks are getting it. However, you can travel, if you travel anywhere, to communities with low immunization rates, because they exist, and they exist as evidenced by all these variants that keep popping up and rearing their ugly little head. And so the science is there. The science proves that if you immunize, if you follow the hand hygiene, if you follow the PPE recommendations, you don't remove, but you lower your chances. And I don't know about other parents, but I would want to protect my children as best as possible. Give them as many resources and as many books in the library as possible to check out when they need to check them out. And when you're having these conversations with parents, I think that the hardest part, especially for those who are really adamant against or hesitant to get the vaccine, is to make them feel comfortable and not like it's an attack, like they have to prove their point or they have to make a stand, and that you're there to convince them otherwise, right? If you can get them to lower their guard by just saying, hey, we're just having a conversation about this because I want to make sure that you understand I want to know what your understanding is so that I can help you fill in any gaps that you may have. Your job isn't to convince them to get the immunization. It's just to make sure that they have all of the information necessary to make an informed decision. And you're still going to find parents, we still have parents who don't want to get their kiddos vaccinated for whatever reason, and that's okay. But that's, our job is just to make sure they have that full understanding of what's going on. Does that answer your question?
Great, thank you.
Right. Anyone else? So going kind of on that topic of those who are unvaccinated, what can be done, and also to Snow's question about what can be done about the dealing with folks who were unvaccinated. And ideally, you avoid close contact, which is 6 feet or 2 meters or more. You want to keep that distance as much as possible. You only want to interact when it's absolutely necessary, close up. And you try to, if someone is sick, if you're sick, stay home. I really hope that after all of this, we have moved away from this idea that we have to show up to work, regardless if we're sick. And people really understand that it's not just good for you, but it's good for everyone else around you if you stay home when you're sick. Now, if you're sick, you take a COVID test and it's negative, it doesn't mean you're not sick. It just means you may not have COVID. There are over 200 viruses that cause symptoms that are similar to the common cold. All of them you can share. And part of, I would argue, is one of the contributing factors to the spread of COVID is that folks were, especially in America, were so bred to believe that we have to show up to work no matter what. And, I only have so many sick days and this and that. And so, but the bigger picture is to stay home if you're sick. Additionally, you want to make sure you wash your hands. Washing your hands in clean water has done more for the world as far as public health and longevity than anything else. Clean water, it's so massive that we can't really quantify it. That's the impact that it's had. And it's pretty powerful. Clean water is an amazing thing. And if you've ever visited areas who don't have clean water, you start to appreciate it really, really quickly. So keeping your hands washed, making sure that you're doing it for 20 seconds with soap and water as often as possible, especially if they're soiled visibly. You can use that alcohol-based hand sanitizer if they're not, if they're going in between patients or after you've eaten or whatever. And then you want to make sure that whatever you're using, because I know a bunch of products have come out, that you use at least 60% alcohol in whatever's in the bottle. And please don't, we used to call it, when I used to work wait tables, we used to call marrying the ketchup. So you pour the ketchup, the half empty bottle into the other half empty bottle, you have one bottle. Please don't do that with the alcohol-based hand sanitizer, because they do have expiration dates. And if they're not the same, and even if they are the same, you don't ever want to mix those. Up next, I would say a face mask. Wear at least a level 3 face mask especially if you're going into folks' homes. And if you've been fitted for an N95, wear an N95. It's a pretty easy process to get fitted for an N95, and all organizations have to have someone who can fit test somebody. It's an OSHA requirement. And the thing about fit testing that a lot of folks don't know is that once you've been fit tested for that mask, that specific mask, and you can't go use another mask because you haven't been fit tested. And so to make sure that you have a good seal, it's always good to go through that process with each and every time you have to change out your masks. The next thing I would suggest for those, especially when you're interacting with those who are not immunized, is to make sure you cover your sneeze and maintain proper cough etiquette into your elbow. I prefer into the shirt, just definitely not out into the open. That's a good way to help reduce your ability to spread. And the thing that I find hardest to do, but it's also recommended, is not touching your face. I think it's like, we touch our face every 20 seconds or something crazy. And I definitely, once you're told not to touch your face, that's all you can think about. So touching your face and touching your eyes, because you have these mucous membranes and you touch things and it gets everywhere. Making sure that you disinfect your equipment if you bring any equipment in, making sure that you utilize disinfection that has been proven to be safe and to kill COVID-19 specifically, and to make sure that you read the instructions. I think one of the positives that have come out of this pandemic is that it's really taught folks to read the label on cleaning products. And I can say, if you ever go to the gym, you see people spraying down their mats with sanitizer and they wipe it off. You've done zero good with that, because one of the biggest things about these sanitizers and these cleaning solutions is the drying effect. And so the dry time is what we call it. And the bottle should have on them the dry time, the contact time that it needs to have before it can be wiped down. So if you don't know, ask. Every organization has to have their safety data sheet, their manual that has all of that stuff in there. So if it doesn't, then you can just let whomever's in charge of that know, so they can look it up and make sure that it's there for you. And I think that those are the biggest things. And also staying up on your immunizations is another great way of helping to reduce, if you make sure you've completed your series, and that goes for everything. If a booster is recommended, then make sure, get your booster. Another great way of helping to reduce the spread. Now, boosters, I'll stop there. Any questions on that? Okay. Boosters, question is, okay, I received my booster. Now how many more do I have to get? And the answer is we don't know. But what we do know is that the immunity that we've received from the vaccine does wane. And it starts out for about 4 to 6 months for adults. And then for like 12 to 15, it's about 3 to 5 months, and they get a booster. Are you going to need to get another booster? The answer is I'm not sure. Most likely, yes. And will it be a booster, or will it be a whole new series? And that will be dependent on the variant type that we have and the efficacy of that immunization against that variant. We cannot predict where the virus is going to go, and anyone who says otherwise, I would caution you from listening to every word they say, or at least take it with a grain of salt. Anyone who says they have all the answers, I always question and take with a grain of salt. But most likely the thinking is in general is that eventually COVID-19 will have this cyclical, seasonal, probably along the same lines as the influenza virus. Because mostly around January, February, March kind of thing. Do we still get flu cases in the summer? Absolutely, they still exist. But in general, those occur. The height of it's around February, March, and then there's sporadic cases throughout the year. So that is the thinking of where this is going to go. Now, as far as protecting communities and things that you can do to mitigate the spread, and Snow touched on a little bit prior to, I think, to the recording, talking about ventilation. High quality ventilation systems are really, really important in buildings. And thankfully, another one of the positives that have come out of this whole pandemic is employers are taking ventilation extremely seriously. And they're on top of making sure that the HVAC system is up to date, that it's been, the maintenance is up to where it's supposed to be, that it meets the requirements for that kind of thing. And then masking. If I go to a place that, like if I go to the store, if I go somewhere public, I wear my mask. I know the mandate says that you don't have to, and that's okay. I don't wear the mask to protect myself. I wear my mask to protect the people around me who aren't immunized. And there's this very interesting cartoon that shows two guys, I'm assuming, peeing, right? And like without any clothes on, there's nothing stopping them, right? But if you put pants on, like the mask, it reduces how much can be transmitted. So continue wearing masks if you don't feel safe in an area, or if you're in a giant crowd. I recommend wearing the mask to protect the people around you. And the way that I look at it is I'd rather wear a mask and be uncomfortable for a finite amount of time than to know I had anything to do with causing someone to be sick and potentially die. Because it's pretty powerful if you think about it. You know, humans are walking around as these giant weapons that can go off and we don't know when. We may not even feel it. I've had COVID twice, and I only know I've had it because we had antibodies tested for donation, and they were 9 months apart, but I was never symptomatic, ever, not once. I'm just fortunate. And this is before my immunizations. It's back when I was working in the critical care and telemetry units in New York City during the height of the pandemic. And I wore my mask everywhere. I made a point of leaving my coworkers and going eating lunch by myself because I just couldn't deal. I did not want to have to deal with the emotional impact of knowing I had anything to do with someone getting sick and dying. It's a pretty amazing thing to think about. Like, you know, wearing a mask really, yeah, it's uncomfortable. Are we tired of it? We all are tired of it, 100%. But wearing that mask for a little bit of time can save countless lives. It's like clean water. You're never going to know how many people you didn't kill, but you know you've done your best to reduce that odds of killing anybody. And with that, I will see if there's any other questions.
Sure, I'll jump in here with a question, Kailyn.
Hey, yeah, Theo, what's up?
So often, you know, masks and mask mandates have been one of the clear ways in which many people in our region have been impacted by COVID on their day-to-day lives. Folks haven't lost family members or themselves been sick. And so mask mandates seem to be one of the biggest triggers for people to use the phrase, this is over, or this is nearing being over. And what would you say to somebody who says, like, look, you know, I don't have to wear a mask anymore. COVID's clearly on its way out. Why would I even consider it? Because what I'm hearing from you is that masks are a key part of keeping each other safe. But if the mandates are gone, why do I still need to wear one?
Yeah, that's a great question. Thanks, Theo. The answer is you don't have to. If the governor says we don't have to wear them, we still have to wear them in certain settings, but we don't have to. However, going back to what I was saying earlier, it's not you don't wear the mask for you. You wear the mask to protect other people. You wear the mask to protect your 85-year-old grandmother who is considered, immunosuppressed because of her age. You wear your mask to protect the children who can't get immunized yet. And I can't overstress the idea that when I think, why am I wearing this mask? Because we all go through that process. You just want to take it off and rip it off. Do you want to be responsible for killing a child? There are certain individuals who have been okay with maybe transmitting it to older folks, certain populations and states who shall remain nameless. But nobody wants to get a kiddo sick, right? And so think of it that way. And it's not just some abstract idea of maybe. The answer, it's a fact. You have the high probability of transmitting it, and you may not even know it because you've either been immunized or you've recently had it, or you just happen to have one of those immune systems that can deal with it, like mine, and never become symptomatic, but you're still probably transmitting it. So for those individuals who say it's over, I don't have to do it. That's right, you don't have to do it. But do you want to be responsible for getting some baby, some other mother's, some other father's child sick and potentially die? Because the ramifications, besides, it's not just getting sick. There's this crazy new diagnosis for children, right? And causing this systemic inflammatory response. And they don't, doctors don't know what to do with it. Prescribers don't know what to do with it. There's treatments and kind of protocols and stuff, but it's, what do we do with this? And it can all be prevented by someone who just, acknowledge your frustrations. I think that's super important. I think it's important, especially as providers of any kind, to acknowledge someone's frustration. Don't minimize it. Don't belittle it. It's valid, right? And see, I understand, I hear your frustrations. Telling someone that you hear them can go so far. And it's something that it seems silly and something that I've like kind of rolled my eyes a little bit about when I was in school. I was like, okay. But I can't tell you how many times I have used that phrase in various contexts. And the affect, how someone looks, how they're presenting completely relaxes. And going back to what I was saying, earlier, getting them to reduce that wall, they're let down their guard because they know you're respecting them and you're not there to convince them. You're just there to educate and to fill in any gaps and to make sure they're actually making an informed decision, I think is key. Thank you. What other questions do you have? Are there any topics, not necessarily maybe questions, but maybe topics that anyone wants to talk about?
Hi, this is Kate. I kind of have the opposite issue with staff. So working in a medical facility, but being able to take masks off when we're in non-patient care areas for like a meeting or something like that. And just wondering about staff who are kind of worried for themselves, or so you talk about wearing the mask for other people. Thoughts and ideas on how to support people who are worried for themselves.
Wearing N95s, getting fit tested for N95s is a great place to start. Virtual meetings is another one. I'm a huge fan of virtual meetings for lots of reasons. You don't have to be scrambling to run from one meeting to another. So if for those individuals specifically, if they have that concern, you can offer a virtual meeting option. You can also, I'm also a big fan of those giant plastic dividers that are in between folks, keeping them 6 feet apart. So it minimizes, doesn't get rid of completely. There's very few things aside from living in a bubble and never interacting with another human to completely eliminate any chance of transmission. But there are definitely things, and they don't have to be big things. They can be very simple protocols and procedures you can put in place, like the virtual meetings, getting properly fitted for N95, putting up those plastic guards. And then instead of having one giant meeting, maybe break up the meeting so that it's smaller groups. So you can do group A from 1 to 1:30, group B from 1:30 to 2, that kind of thing, to help minimize those folks, their risk, and then help alleviate, because it's a real concern. And again, I think it's important to validate their concern, because they have lived through most likely the past 2-3 years with this pandemic, and their fears are valid. Their fears are very, very valid. I frankly am tired of seeing people die from it, especially needlessly. And I think that allowing them an opportunity to still interact, but in a different way, is important. It's a really good question.
Great, thank you.
Yeah, thank you. Omicron B, thank you. BA2 alphabet soup, right? Alphabet numerical soup. So with Omicron, what does it mean? It's another variant. And a variant is just the Omicron version was able to mutate in someone's body, and then it's able to fool the body just enough that the vaccine you took before it's not as effective as it was. But those who are immunized are less likely to die from it. And I think that's a really important thing about immunizations, and something that I really wish public health would push is really educating folks on what vaccines do and how they work. Vaccines aren't a magic bubble, they're not a force field. They just allow your body to recognize these diseases or these viruses sooner, so that your body can fight it off faster. And if you can, it's easier to fight off 5 guys than it is to finally realize you're in a fight with 30, right? And that's basically how immunity works. And so with the variants, those who aren't immunized, they're next to a community that is immunized, and that Omicron has moved over to the unimmunized folks. It was mutated, and then it shipped back to the vaccinated folks, and that's kind of how that works, and it creates this little cycle. So people want to know when it's going to be over, when are we going to stop having variants. The answer is I don't know, but it's definitely going to happen faster if we get more people vaccinated. Good question. What else do you have? Something else I'll say about, I guess, variants. So, the comparison everyone likes to make is with influenza. And so with influenza, the reason why we have to get a vaccine every year is because they have these markers, and it's like a deck of cards where, the deck of cards gets shuffled. And most of the time, it's not that big of a deal because mutations usually wean themselves out. They kind of kick them because they can't reproduce, and then the cell dies, and so on and so forth. With COVID-19, it's interesting because it's one giant long strand of RNA, and it's able to actually it's extra long. It can be cut up and taped back together in a variety of ways that is able to survive in a way that the flu isn't. And it's why it's been so crazy and so virulent, right? So it's been able to get around faster, and it's seemingly stronger because it doesn't learn because it's a virus. It's not really alive. And that's a different debate for a different time. But the variants, we really want to be immunized, use our PPEs, wash our hands, cover our coughs, stay home when we're sick. It comes down to those basic things. And the more people we can get to do that while acknowledging their frustrations, the sooner we can get through this as a group, as a community, as one giant community. Great. Any other questions? And feel free to use the chat too if you don't want to speak up. Another great reason to have virtual meetings is you can get those individuals who are less inclined to speak up to ask questions. I love that because usually some of the best questions come from the quietest folks. Even if you think it's silly, with this particular topic, ask as many questions as you need to, and so you really understand, or you have a better understanding of the topic. It's never wrong to ask a question, especially in this setting.
I have a question.
Yes.
I wasn't hesitant, but anyways.
Yeah.
So now that the mask mandates are changing, and I understand when you said that we still use the mask to protect others, but that may not be the thinking of everybody around us, right? I personally am a parent of a toddler. Still no word on when the vaccines would be approved and when they would start getting that protection. So I'm always anxious about taking him anywhere outside, especially now when the mask mandates have changed. So how do we as parents go about navigating the situation where we have kept our kids in a shell for 2.5 years now, 3 years now. And now we want them to see the world. They want to go out and do stuff, come to grocery stores and stuff like that. So what is your take? What would you like to advise parents like me who are anxious about changing mask mandates and still some age groups not getting vaccinated?
Great question. I'm glad you said something. So first off, as a parent, I would suggest with other parents, if they're going to like a play group, play date, those kinds of things, is just to be honest and say, I'm really concerned that since my kiddo is not able to get a vaccine yet because they're too young, I would appreciate it if you would wear a mask, or if other parents would wear a mask that are coming to the group. And what you've done with that, especially, and you can do that with the same sort of tactic when you're talking or going to other people's homes as a healthcare worker, by saying that it's me asking it for my sake, and giving the other person an opportunity to be a little bit of a hero, right? Like say, okay, I'm doing this for you. I'm going to protect you. And instead of saying you have to wear a mask, I'm not coming over unless you wear a mask. That's not going to be very productive. And I don't know many folks who would receive that like that. And so by making it about you and your child's safety and your concerns, there's still going to be pushback from folks who don't want to wear it. And my recommendation for that is, then I'm really sorry that we can't agree on this. Until I can get my child vaccinated, we won't be in this play group. And it's unfortunate, but it comes down to, as a parent, you have the decision-making authority to do that. Like, is it more important that they get interaction and social interaction, or is it more important that they stay safe? And there's definitely a point where, you can go too far with those types of things. But if folks are outside, being outside is another great location, in parks and in areas where there's a lot of space that kids can take from each other, with each other, parents can take with each other. And it's kind of similar with the going shopping. If you're really hesitant, and understandably so, my recommendation is you can call the customer service desk there at the stores and ask them when their low period is. And so, like, do they have fewer guests that come in the morning, in the afternoon, around noon, whatever it is, and then introduce your kiddo to shopping that way by reducing the amount of contact that they have. And it's a great opportunity to demonstrate proper hygiene when you're going into the grocery store, right? Because most grocery stores have little alcohol wipes or the hand sanitizer, and you can show them and reinforce the idea of hand hygiene and wiping things down and in drying time. And I tell you, time never moves so slowly than when you're waiting for something to dry. It may be 15, 20 seconds, but it just seems like it's forever. And then you can walk them along the different aisles to shop around. And most grocery stores that I've been to still have the plastic up, the dividers up for the registers. So that's nice. And so I recommend calling in to, because most grocery stores have that customer service desk, and you can ask them when they think that the low periods are. And I think that would be a smart and effective way of introducing those who can't be immunized or those who are immunocompromised to the public. Great question.
Thank you.
Of course. What other questions do you have?
So one more question.
Yeah.
Now there was a lot of talk about, we started with vaccines, like 2 doses are mandatory. Then we came up with a booster. Now there are talks about another booster. So how long would it continue to go like this, wherein we would have to boost our immunity to meet the responses of the mutating virus? And would this also be something like a flu vaccine, which we'll have to possibly take every year to get the protection on?
Great question. And the answer is we don't know. And anyone who says otherwise, I caution you from listening, or at least taking everything they say as canon. But I will say this: we've already required 1 booster, possibly another booster, especially depending on your situation. If you're immunocompromised, elderly, those kinds of things, cancer survivors, going through chemo, those types of things. And so it comes down to, we call them titers, so the concentration of that immunity in your system. And we won't know the answer to that until we can see we have more time that goes by, so we have more data. to look at, and to see that at this point there's a threshold where the vaccine you were given this many months or this many years ago is no longer effective. And a great example, another kind of something analogous to this, is like people get their MMR, right? Measles, mumps, and rubella. People get their chickenpox vaccine when they're younger. Now, anyone in healthcare knows that most people have to get their titers checked. You think, well, why do I have to get my titers checked? I was immunized. The answer is because immunization doesn't remain constant or at the same levels for everybody throughout their life. And it just happens to be, your genetic makeup. Who knows what the reason is. So you do these titers to make sure that you still have immunity so you can protect yourself and your patients. So the same idea holds true with COVID, in that we don't know how many we need, but we will be testing, and by we I mean generally in the science and scientific community. And if I'm guessing, I would say that most likely it will probably be an annual thing, just because of that ability for it to mutate. So a lot like the flu, it mutates, and it's really hard to predict, but it has a high efficacy rate. It's not 100%. Very few things in life are 100%, but you're definitely going to be better off. I'd rather get a shot every month than again, knowing that I personally got someone sick and potentially caused them to die. Great question. And with that, we have about a few minutes left, and just want to see if anyone has any questions. If anyone's shy and decided that they're ready to ask a question, please feel free, throw it in the chat. Okay, Abdi, other than masks, what can we, in addition to protect ourselves and others as well? Great question. It goes back to the basics. Play it smart. So if you're going into an area you don't know, it's not family, you don't know the immunization status, if you're traveling, wear a mask. Wear a mask that fits you well. Wear a mask that you can tolerate wearing, preferably a level 3 or an N95. Again, make sure you're fit tested for it. And every time you change your mask, every time you change your N95 type of mask, make sure you're fit tested. Wash your hands. Try to distance yourself as much as possible. If you're traveling by air, one of my favorite tricks, and it's something that I have done way before COVID, is the little air nozzle. Point it to your chest, not your face, your chest, because what it does is the air comes down and creates a little bit of it's not 100%, but it creates a little bit more of protection because it blows away anything near your face. And I've done that forever. And, FAA is still requiring us to wear our masks. When is that going away? I don't know. I wager, I guess, that it may not be going away. And I'm surprised that it's taken this long for them to kind of get there. And kind of a tangent on that is, people think that, when you're in the airplane, that it's recycled air, right? That goes through, that you breathe out, it goes down and it goes to the person behind you or whatever. That's not the case. You breathe out the air, it gets sucked down by their HVAC system, and they have amazing systems, and it gets blown out of the plane. It never comes back through. So that's not a thing. When I explain that to people, they're just like, what? Washing your hands. And really washing your hands is a huge factor. A good solid 20 seconds. When you're using the alcohol-based hand sanitizer, a little daub doesn't do you. You've got to really put some amount in your hand so that you really coat your hands and you really let them dry. So mask it, play it smart, distance yourself, say a mask, wash your hands, yeah. And wearing the proper PPE is probably the most effective way to keep yourself safe. Perfect. And I think with that, we are out of time. I want to thank you so much for having me here. It's been a pleasure. I appreciate the questions.
Thank you so much. Kailyn, this was amazing. I mean, And I love the way you let us ask you questions so that everything got answered as to why we are sitting here and listening to the amazing information you just gave. I mean, I was blown away with the last tip about air travel. I have been always worried about that, and I'm sure now when people would be starting to travel, they must be really wondering how safe it is and stuff. So thank you very much for this amazing session. And thank you so much, Theo, for coordinating and making sure that Kailyn has time for this session. And to the rest of our partners, thank you so much for your valuable time being here, asking wonderful questions. And we'll keep engaging with Theo and Kelly and see if they can come back to us with some more different topics and some more information. So thank you once again, everyone.
Thank you.